Hello, everyone. Welcome. Thank you all very much for coming. It's wonderful to have so many people turn up for the fourth session of our Living Well with Prostate Cancer webinar series. For those of you who are new, welcome. For those of you who are old hands now and have been to some of our previous sessions, welcome back. My name is David James. I am the head of patient projects at Prostate Cancer Research. Now, I apologize for those of you who have had to listen to me tell you who Prostate Cancer Research are before, so I will be brief. But Prostate Cancer Research, we are a medical research focused charity that's focused on the prevention, diagnosis, and treatment of advanced prostate cancer and better quality of life outcomes for patients. We're very proud to fund 15 high quality innovative projects right across the UK, from London to Aberdeen, Oxford to Cambridge, Cardiff, Norwich, and everywhere in between. Now, we have a shared aim across all of these projects of developing breakthrough treatments so that one day we can live in a world where people are free from the impact of prostate cancer. So some of our most cutting edge projects include one where our scientists are using IT and machine learning for artificial intelligence to see if we can divide and conquer prostate cancer. By looking at an enormous amount of data, what they hope to do is work out which cancers need to be treated and which we can just safely ignore, and then picking out the right treatments for each individual person, depending on the type of cancer. But we also have projects focused on existing treatments as well, trying to make them better by reducing their side effects and looking to ensure better outcomes for people affected by prostate cancer. And that includes radiotherapy and hormone therapy, amongst those. Now, I'm going to take just a brief moment to tell you about one of the newest research projects that we've just announced funding for. So the WNT pathway is a set of signals that have been shown to play a key role in prostate cancer. The signals are released by one cell and taken up by surrounding cells, causing them to grow and then move uncontrollably. And this results in cancer growth and spread. So Dr. Toby and Dr. Helen from Cardiff University hope to learn how these signals control prostate cancer spread and discover whether blocking the WNT pathway prevents spread. So the researchers are actually particularly interested in the factors that control the spread to bone, because why and how prostate cancer spreads to bone are big unanswered questions in prostate cancer research. So there is already actually a drug that blocks this pathway, and it's being tested in patients with other cancers. And so what the researchers are looking to investigate is whether this drug could also be used to treat advanced prostate cancer. This project starts next month, and it will run for 3 years. And actually, speaking of next month, on Tuesday, September 7th, at 12:30 until 2 p.m., we're going to be hosting a virtual lab tour with Dr. Toby and Dr. Helen. And this is an opportunity to find out more about their research project. The event will take place on Zoom, just like this. And we'll also hear from some of our other scientists and supporters before a Q&A session with Dr. Helen and Toby. So I'll share a link to that event in the email that I send out to all the attendees tomorrow. But I just wanted to let you know, and if you're interested in joining that, we'd love to have you. So obviously, beyond our research, we're also dedicated to educating, empowering, and supporting our patients, our partners, families, and carer communities. And that's really why we launched this Living Well with Prostate Cancer webinar series in collaboration with our good friends, Tackle Prostate Cancer, the UK's National Federation of Prostate Cancer Patient Support Groups. So next month, we're going to be covering nutrition and prostate cancer with information and support on nutrition during and after treatment, managing side effects, gut health optimization, immune system support, and information about supplements. We have 3 really excellent sessions on the afternoons of September 13th, 20th, and 27th. And I'll also include details about how to sign up for those if you haven't and are interested in tomorrow's email. So, again, apologies to those who have been here before, but just a few housekeeping points before we get started. This is not a Zoom meeting, which many of us are used to, but it's a Zoom webinar. So that means all attendees' microphones and videos are muted and off. And the reason is so that we can actually record this session And then we'll be sending this out to you afterwards and also be sharing it with those who weren't able to attend on this fine Wednesday morning. So the first about 45 minutes of this session will be a presentation from our dual speakers today. So it's a first for us. We've got 2 speakers today, which we're very excited by. And then we're going to open up to questions and answers after that. So there is no chat function, but if you have any questions, whether that's a general point or you're having some problems or just a general question about the session itself, just type it in the Q&A box. And then we'll, either address it during or obviously in the Q&A section afterwards. So once again, just a reminder, this session is being recorded and we'll be sending this recording around to all of you in tomorrow's email. So finally, I'd like to thank the charity Penny Brawn UK, who have led our first 3 sessions and who are leading today's webinar as well, the last in our Whole Life Approach month. So it's with my very great pleasure to hand over to our presenters today. We have Alex Turner and Marcus Heimpel, sorry Marcus if I butchered your last name, who are wellbeing consultants at Penny Brawn UK. And hopefully I will just unmute them and turn their videos on because we seem to. Marcus and Alex. Oh, we've got one. We have Alex and we have Marcus. Fantastic.
Okay.
Over to you both.
Thank you, David.
Thanks, David. Hi, Alex. Hi, everybody. That feels really weird, so I just have to say that I can't see anybody else. I'm new to that, so it's great to see you, Alex. Got my mate here. So, well, I'm talking, so I'm starting. So my name is Marcus Heimpel, and I've been at Penny Brawn Cancer Care for the last 12 years. And I'm a body therapist. I offer shiatsu, this acupressure massage, and I've been a group facilitator for many years at Penny Brawn. So as part of that, we've been doing wellbeing courses around the UK, 2-day wellbeing courses, and me and Alex both been around the country and talking to groups of men and their partners about wellbeing and prostate cancer. And yeah, I'd let you introduce yourself a bit before we go more in how we want to run the morning.
Thank you, Marcus. My name is Alex Turner. Similarly to Marcus, I've been at Penny Brawn UK for 10 years now. I came on the back of being a shiatsu teacher and also an acupuncturist. Before that, I trained as a Tai Chi and Qigong teacher. So I've been practicing in a variety of forms Chinese medicine for over 30 years now. So I'm looking forward to bringing a few of those nuggets of gold to this session today, and some as a kind of self-help or a tool for your toolkit to support you in the variety of ways that you need supporting. Yeah, look forward to doing something quite practical today rather than going through lots of slides and showing evidence and research. But I think we're both going to be coming from that angle of doing some practical stuff. So hopefully you'll enjoy that. Thank you. Back to you, Marcus.
Great. Okay, so how yes, as Alex said, this will be more a practical session and participatory session. So unlike the other webinars with us, we don't use any slides, and it's very body orientated. And the invitation is for you to together with us to explore some movement and some self-care tools. So our topic is on well-being and self-care. And so Alex will start off in a minute with a little bit of Qigong doing and maybe some pressure points. And then I will afterwards come more into some areas of self-touch and self-connection to the body and using our body as a resource. and how that fits into the whole well-being model. You know, we talked about mind and emotional impact. We had a chance to talk with Alan and to look at that a bit. Elisa talked more about the exercises and movement, and I suppose that links in a little bit what Alex and myself are doing. And from Kaswin, you would have the whole integrative approach. And how I see where Alex and my offerings go. So it's particularly in the self-care session, but as well using the body as a resource. And so in a resource for mental well-being, for emotional well-being, and how I see the work that Alex sort of brings us into. Alex, you can tell a bit more about that. It's about connection with universal energy as well. You know, we're with a life force, so we can bring the life force, which helps our well-being, but as well can help with some side effects of cancer treatment and of the cancer experience. So Alex, are you happy to kick us off?
Sure, thank you, Marcus.
Yeah.
Maybe some of you who maybe haven't been to these webinars before and are not clear about, you know, who Penny Bron was or what Penny Bron is. So just to give you a brief introduction to that, Penny Bron is a charity that was set up over 40 years ago now. And it was founded by Penny Bron, who had cancer. And she'd felt that the one particular type of treatment that she was receiving in the kind of Western conventional way wasn't enough for her. She felt like she needed more of a holistic approach. So she went to Germany and got treatment there that really focused on not just the physical aspect, but the body, the mind, and the emotions, and the physical. And seeing that as an integrated world, basically. Penny was an acupuncturist, so she already came to her healing journey with that background of looking at the body in a whole person way. So we really, again, you know, what we're doing today is bringing that energy to this talk to really show that the influence of our mind and how it can affect us physically, the influence of our emotions can affect us mentally, etc. So it's this big motion of cogs that are working together, and we're really trying to get a nice oiled set of cogs together that are moving in harmony and creating balance. So that's a little bit about, you know, Penny Bron. You know, we offer counselling, we offer nutritional therapy, body therapy. So it can be a range of exercise. We also offer one-to-one sessions online to signpost and support people with cancer. And we also run something called a treatment support clinic, when previously we could work face-to-face. One of those treatments was acupuncture. So that was supporting people with the side effects from conventional therapy, like chemotherapy, hormone therapy, radiotherapy, etc. And in that time, I've you know, also worked with many people with prostate cancer. So I'm aware of some of the side effects that can be caused by conventional therapy. And I'll bring some focus to that in my session, as will Marcus. And one of the things that is really important is the breath. In Chinese medicine, the organs of the kidney organ has a big influence on the reproductive organs, and also the excretory function and the lower orifices. So, for example, if we are in a situation where we are peeing profusely, for example, we can think about the kidney energy supporting that and finding harmony to the bladder and the excretory functions. So we're having when I mention the kidney organ, and you think, well, what's that got to do with it? You've not really had that connection. And from Western medicine, I'm speaking from a Chinese medicine perspective, but by any means, don't get worried about, oh, what's happening to my kidneys. But we have this language that's slightly different from Western medicine. But when I'm talking, I might be talking about supporting the kidneys to help with the particular symptoms that come with prostate cancer. And one of them is the breath. We say in Chinese medicine that the lung qi, or the breath, helps to anchor the lung. The kidneys help anchor the lung qi. Also, when we breathe in, that the breath also supports the kidney energy. So putting all that kind of language aside, let's just focus on breath being a really important tool to feel like we're being anchored into this present moment, anchored into how we are right now. And this is also a focus of what Marcus and I want to bring to this session, is how we can connect to ourselves in a very authentic way, or as authentically as possible. So finding a position in your chair or your sofa or wherever you are sitting or lying, and really think about your breath. So bringing awareness to your breath. So we're not overthinking, but we're bringing focused attention to our breath. And I'd encourage you to breathe in through your nostrils and out through your mouth. And we want to get a nice flow. So the kidneys in Chinese medicine are also in the realm of the water element. So we talk about 5 elements in Chinese medicine, and the water element is very much the realm of the kidneys and the prostate and the reproductive organs for men and women. So we want to have a sense of how water moves, which is with fluidity. So as you breathe in, feel like you're having a sense of fluidity and continuity. And there's a seamless exchange between the in-breath and the out-breath. So it's not like a hold and then exhale. It's and as you just come to the end of your exhale, you seamlessly move into an exhale. So in and out, like a wave. Yeah. So as you breathe in through your nose, feel the air go down through the chest, all the way down into your belly and into the realm of the pelvis, and the lower abdominal area. Okay. And as you release, feel the release of the breath coming from that place as well. The other thing we can do is we can imagine breathing in the energy that you require right now. Okay. So whatever it is for you right now, imagine that you can breathe that in and you can let go of what you don't need. Okay. So for example, if you're feeling overwhelmed or very fearful, which is something to be partly expected when having a cancer diagnosis, we might want to just still those waters a bit. Yeah, so we're not feeling like we're in stormy territory out at sea. We want to still those waters. We want to calm the nervous system. So breathing in and exhaling, and just getting your rhythm with your breathing. So don't feel like you have to follow a particular method. This is a way to return to you, return to the sense of yourself. So we'll just do that. So if you hear nothing, it's just because we are breathing right now. So breathing in and exhaling. Come to the end of your exhale and breathe in. Just calming the waters. Bringing a sense of stillness. As you exhale, maybe you feel the shoulders beginning to relax. from feeling the breath or whatever you are intentionally breathing in, nourishing you on that deep level. Having a sense of your abdomen expanding as you breathe in and then contracting as you exhale. So we're breathing in energy down into the lower area of the abdomen and the pelvis. As we breathe in, we bring calm to the functions of our bladder, our kidneys, our excretory functions. So if we feel a lack of control because of incontinence or whatever you're experiencing, of course, that's going to bring fear and it's going to bring some anxiety for sure. So as we breathe in, we're also not only stimulating the energy to move in that area, we're also bringing that kind of self-affirmation of, it's okay, let's just calm these waters, let's just take it easy, let's just soften and still any anxiety that we feel connected to this area. If the mind just wanders in with random thoughts, see if you can let them pass by and just focus on your breathing, just breathing in again. If you've experienced a sigh come, that's great. That's a nice release, a sign that we're releasing some tension, some stress. We're slowly moving into the rest and relaxation part of the nervous system. We call the parasympathetic nervous system, rather than that overly driven fight or flight mode, which, as we know, has a big impact on our excretory system. You know, we naturally want to excrete, to run faster, to escape danger more quickly. And then when that's out of balance, again, that's something that we suddenly become less in control of. So as we move towards the more rest and relaxation mode, we may feel like we just have a bit more autonomy on what's happening. You know, a sense of self-care, self-acceptance. Really thinking about stilling the waters. Good. And if your eyes are closed, you slowly open your eyes. And you can just have a stretch if you feel like you need to have a little stretch and a movement. We'll be doing lots of this today. Roll the shoulders back. Good. So I hope that give you a sense of what we can do with our breath to just come back to this place of, you know, it's like the anchor, you know, we call this in night. We have nice words in Chinese, and it's very poetic, you know, that it holds us, you know, it just holds us. We're not in that fight or flight mode where we're anticipating, and we were driven by that anticipation that we are going to be moving into a place that we don't want to be. It's going to cause us fear. And one of those things is, you know, incontinence for sure. So many of my clients have seen that's been one of the main issues. I'm going to cover a couple of exercises. So one is a bit of Qigong exercise. So we've done a breath, a bit of Qigong, and a bit of tapping, which we call Do-in, so it's spelled D-O-I-N, and a few acupressure points that might help. And these are points which I would probably do fairly regularly in my acupuncture treatments for supporting people with prostate cancer. Okay, so hopefully you've got some space where you can stand up and move around a little bit. So really just a square around your body standing up. So I'm going to just move my chair. I'm going to just change my glasses so I can see you from a distance. And hopefully you can see me. Okay. Great. Okay, so a good posture to maintain is where your legs are shoulder width apart and your feet are parallel. So again, this gives you some sense of stability. We're really thinking about stability, stillness, anchoring, really acknowledging that we want to bring some kindness to this place where, we may be feeling some fear or some anxiety. So one of the first things is just brushing over the abdomen like this. Okay, so it's a way to connect. So you want to feel the warmth of your palms, and you want to feel that caring quality of touch through your palms as well. So just brushing down over the abdomen, and you can go over the belly button, over towards the side of the abdomen, around to the line from the armpit down. Good. Or you can even do small circular motions like this. That's like a spiral towards the belly. Good. One of the really important exercises to do is to rub the lower back. So again, there's some really important points to help with incontinence on the sacrum and on the lower back as well. So one of the things we often do is rub the lower back. And what we do, we have a loose fist like this. So it's not tense. It's not a tense, clenched fist. It's just a nice loose fist. So I'll turn around, and then if I find the line where my lower rib cage is, and then where my thumbs meet, it's usually at where the waist comes inwards, is a point on the bladder channel called bladder 23. This is between L2 and 3, so the lumbar vertebrae of the second and third lumbar vertebrae. So it's bladder 23, and what we call this called a kidney back shoe point. You don't need to know that, but it's really supportive of the kidneys and bringing warmth and generating energy in the lower back and into the kidneys to support the prostate. So again, just rubbing the lower back in a circular motion and generating some friction. So you're feeling some warmth in the lower back. So it's particularly good if you have lower back pain as an accompanying symptom as well. So just rubbing the lower back. It's great. Obviously, just do it with all these exercises that we're doing today. Just do exercises or movements that you can do. If they're causing any discomfort, just stop. But hopefully this is quite an easy exercise to keep rubbing. So you want to do that for a few minutes if you can. And then come down to the sacrum. And what we're going to do, we're going to do some do-in. So this is just tapping lightly, or to a point where you feel something moving, you're feeling the energy moving a bit on the sacrum. Okay, so there's some really important points in those holes in the sacrum. So just tapping here like this, over the sacrum. You can have the hand slightly open again, or you can have a slightly closed fist. Great. So hopefully you'll feel a bit of tingling around that area. Another thing is the buttocks. So when we especially when we need to go to the loo, we can't go to the loo. There's that tension in the buttocks that happen in the glutes. So often there's tension in the glutes as well that can accumulate, and then the energy is not moving freely properly in the pelvis and in this lower area. So with the loose fist as well, we can just tap onto the buttocks. And it's almost like we're shifting that tension from the buttocks. Like this. You can work from the low, so you can rub the lower back, tap on the sacrum, and tap on the buttocks as well. Good. And then you can come around to the hip joint, so where the femur comes into the pelvis, and then you can come around towards the inguinal crease, so the groin area, or the lower abdominal area. Okay. Good. And sometimes I really come in with the edge of the hand into the groin area too. Just tapping on the lower area where the border of the pubic bone is. Okay. There's a really important point again in acupuncture. It's called REN3, which also has a big influence on the bladder, but also this whole area here. And it's on a central line which goes right the way through the body, and it's just on that border of the pubic bone. So if you're tapping around here, which is generally a really good area to work, you can also think about this point just on the border of the pubic bone, on the center line. So you can work just around that pubic bone too. Good, and just brushing down. Okay. So we're already, with the breath, with some tapping, we're stimulating energy to move into in this area. Hopefully that movement regulates what needs to be regulated rather than promoting excretion or stopping it. So it's about regulation when it comes to using pressure points and tapping. So the other thing is to move this area as well. So a really nice thing to do, so you have your feet shoulder width apart, just let your hands dangle to the side. And this can be quite difficult if you're not used to this, because we're so used to moving it through the world from this head and the shoulders being tense and using the arms. What we really want to do, and if you've done Alyssa's course last week, she may have talked about this, the importance of your core and of your center. So in Chinese medicine we call this the dantian, this center, and we promote moving from this place as an efficient way to move and an efficient way to utilize our energy. Sometimes this energy can get really stuck in this area, so just turning from side to side, letting the arms just dangle can be really, really helpful, just to move. And your hand will just flop onto the pelvis, onto the sacrum, and will also do that job that we were doing earlier. which is to stimulate and regulate, rebalance the energy in your reproductive organs, your excretory organs.
Alex?
Yes?
Let me just give you a time check. We're about 40 minutes into the session.
Okay, how long have I got left?
35 to 40 minutes in.
Okay, so I'll stop in a moment. Is that right?
Yeah.
Okay, so just letting the arms just flop onto the body. So you're, again, getting this sense of moving the center. Good. Great. So time just whizzes by when you're having fun. So I'll just pause with the movement there. So there's some breath work, some tapping, some connecting with yourself through this quality of touch, which is so important, especially for us men who, are not used to doing that largely. It's like really bringing self-care and self-compassion to the situation. I'd like to show you just one acupressure point. So I've shown you one that was on the back. Oh no, I showed you two actually. So there was REN 3, there's REN 3. You can Google that and have a look for the exact point. And then there's bladder 23 on the back. There's another one on the ankle. So if I just quickly show you this here, I can just put my foot over my knee like this, and I'll draw a line from the tip of the ankle bone towards the Achilles tendon. And midway, there's a point called kidney 3. And I can just place my thumb in there, ideally with a perpendicular pressure with the thumb pad. And you just do it to a depth where you feel a connection. It's not painful, but you feel maybe something's happening. Don't worry about what that is. It's safe. It's going to be supporting for your kidney energy. And you can even then, with the other finger as well, so if you have thumb on the inside of the ankle, you can come exactly, so you stick a needle all the way through, you come out at a point called bladder 60 on the other side. So you can just hold. Again, both of those points are really good for our excretory functions. Good. So while Marcus is doing his session, I can just put those points into chat if you like. Okay, Marcus, is that time? Shall I hand over to you?
Great, Alex. Thank you very much. That's been really brilliant to get us into the body in this active way. So through the breath and through the movement. So my invitation is for everybody to just have a minute or so of quiet. And if you were able to follow Alex, breathing and the movement and exercising, to just notice how your body is now, notice how your energy is now. So it's like sort of quiet reflection, and to notice what has changed for you. So you can sit or stand or lie down. And just coming back, noticing what your breath is like, noticing what your temperature is like. How is your energy now? How is your mental state? How are your emotions? So we have 1 minute of just sitting and breathing and being aware. Great. And then letting that go and coming back to each other again. And maybe just think as well, from the different things you've done with Alex just now, is there something that you think you might be able to do for yourself? And particularly noticing what was exciting, one of the things you might actually like and enjoy or become curious about. So really what we're offering is that ability to connect with self, connecting with the body. And we decided to have the session more experiential than too much information giving. And I think what I like to do to bring a little bit of self-touch in. So with Alex, we've done the self-movement and we've done the breathing. And there's something about self-touching, and in the self-touch, we can bring self-soothing. And particularly having been in COVID for recently, and some of you been quite vulnerable, have been in shielding, and the contact is much less with people around us. So self-touch can really help to connect with our body, with ourselves. And we as well, we bring a bit of connection to the pelvic area in there too, to make it relevant to the prostate cancer and the prostate difficulties. But a really good way is to come in more neutral areas to start with. Maybe to start by bringing touch to the face. So if my invitation is for you, I will guide you through a little bit of self-touch, and you can, if it feels comfortable, follow that, or just let your hands go anywhere in the body where they feel comfortable. So we'll be having, because cancer, even if the cancer is in the prostate, it'll affect the whole of the body and whole of our being. And lots of us hold tension in the shoulders, holding tension in the neck. So the invitation is to bring touch and a little bit self-connection, self-massage, and starting maybe on the face, feeling into the jaw, back of the head. So not trying to achieve anything, just allowing to feel. What's it like to feel my hands on my body? Your hands might be warm, your hands might be cool. So really coming into that physical sensation. It can be very helpful with anxiety and worry. You know, we're coming out of the head into the body. So it can be a really nice squeeze around these tight muscles in the shoulders, coming down the arms. So you can follow me where I'm going, what you see me on screen, or you can follow your own exploration. Now, as a culture, we don't do that very much, particularly when we're in company with others. We all sit quite often. We might sit quite quietly, quite well behaved, but our body, you know, our body is an animal body, like the animals around us. And I've got lots of inspiration when I'm watching the cats, the dogs. You know, they don't sit still very much, or when they're very alive in their bodies. Yeah, noticing response in the body. The breath might change. Maybe you have a stretch somewhere. It's really nice going through all the things. So what we're doing is we're starting bringing connection to all the different body parts. It's nice to start with an easy reach. You know, the arms are nice, the neck, the shoulders is nice. You can come also to the chest. Alex was talking about the breath in the chest. You know, for some of us, when fear comes, the breath is quite held. And just bringing the touch to the chest and feeling into the spaces in the ribs, so we can have the fingers coming in the spaces in between the ribs and just giving a little bit of a wobble like that can start those muscles to bring a little bit of relaxation into them. Yawning is good. Yawning is very much about tension release. Very important to come in the sides of the body also, thinking of that three-dimensionalness. So we're not just the front. You know, these days when all we have is Zoom, we just see each other's tops. So really coming to the sides, feeling your sides. And it's about being gentle with yourself. So starting, maybe even slowing it down a bit. If you're not used to that, we have a tendency to be quick, fast, maybe to be a bit strong. So what's it like to bring a softness, a real softness to the body? Welcoming, hello body, I can feel you. Hello breath, I can feel you. Yeah, maybe even slowing it right down. Now, what's the temperature of your hands? Are they cool? Are they warm? Are they dry? Are they clammy? You might be able to feel that through. Then also I want us to go into the legs. So the lower body is often neglected. Now we don't see each other lower body. So really connecting to the thighs, maybe giving a little squeeze. Now when we have particularly prostate cancer, this happens around the prostate, which is around the genital areas, and this can be very invasive, the surgery you have. If you have to get the checkups, it can be very invasive. The prostate has to be checked. So there's lots of tension can happen. And it's more just saying hello to the pelvis, saying hello to the thighs, saying hello to the buttocks. You can sit on your hands a little bit, finding your sitting bones. And also coming down further, coming down to the knees. So it's really connecting into the legs, connecting into the earth, coming all the way down to the ankle and to the feet. So ideally, I would spend a little bit more time with that self-connection and self-touch. I want to become more specific in the pelvic area. But before we do that, let's just take another moment of just sitting, not doing anything specific. You don't have to close your eyes or sit in a specific posture, but more noticing, how is my energy now? How is my mind? How are my emotions? What am I feeling? Great. So my experiences, connecting with my body can really help with anxiety. And if a cancer diagnosis comes, sometimes, particularly with treatment, we can dissociate from the body. There's like we go in the head, or like we live ourselves. If you had surgery, if you had radio implants, sometimes we can be numb. We can numb out from that area, and bringing self-touch, this loving, accepting, gentle touch that can help the integration of a process. So what I want us to look at a little bit more, actually, is that the pelvic area, and just to show you the pelvis, so the prostate sitting somewhere deep inside here, and then the sort of the genitals, I don't know how you call it, the cock, the penis, it's sort of out there, but it's all very much related. And you can see here the pubic bone is coming there, coming up to the pelvis, it's called the iliac crest, we can feel that. And we have the sitting bones in the back here. And I think the few prostate groups, when I've been out in the regions as well, to particularly work with men with prostate cancer, it's been quite difficult to talk about the feelings. It's been difficult to talk about the impact it might have. I remember, sometimes men have to wear pads, continence pads, because of incontinence pads. There can be erectile difficulties. There can be things around intimacy, around sexuality. It's all quite difficult stuff to talk about. And even in the group, when the men's come together, there hasn't been much conversation. But what I know about being a body worker for many times, and when I work with clients, and particularly around surgery, around cancer, that we can numb out. And so my invitation is for the next few minutes to come into standing, because in standing we can have more movement in the pelvic area. And as you've seen on the skeleton, I want us to, because we can numb out from sensation in that area. And I think with Alex, we talked about bringing the tapping. So this is like quite a strong waking up But I'm sort of curious to be this more, as well as coming into sensation, into sort of starting a little bit more gentle connection. And I really want you to find your hip bones to start with. If I bring the skeleton here, I'm looking to start to connect with these bony parts here. So really feeling the bony parts of your pelvis. And we can use the bony parts of the fingers. So bone likes to feel bone. And then start allowing your body to respond to that touch and maybe bring a little bit of movement in. You can start by shifting your weight from the right to the left and notice what happens under your hands. And so we can slide, if you can see my fingers, my hand is sort of sliding over the top of the bony area. And in the back with my thumbs, I can follow it down towards the sacrum. So it's about this, when we touch bone, this often can bring reassurance. We can feel the structure. And then the next thing I invite you is to come up to the pubic bone. So if Alex talked about a point here, when 3, I think 1, 2 is about 2-3 finger widths above from the pubic bone. So I want you to find your pubic bone. So you come down the belly to the bony part. You might need to move around your buckle, coming down. And just feeling for the bones. So it will be above your penis. You know, if you're a man, if you're a woman, so you can feel that, looking for the bony part. Again, if I bring my skeleton here, if you're not so familiar, it's this part, the bony part coming together here. And what we're looking at, if we had trauma in this area, if we have surgery, so it's about bringing gentle touch. And again, you can sway your body from side to side and just notice, feeling connecting to that bone, to the bony part there. Letting your body breathe, noticing you might have tension anywhere else. Maybe even take a little step forward, a little step back. So we'll be looking for bringing a bit of movement, natural movement, letting your body move how it wants to move. Don't just copy me. You know, nobody can see you. It's a webinar here. So you're all in your privacy. And then maybe become a bit curious. How does this bony part there, how does that connect to the bone up here? And then we can do a little bit of tracing down. The next step would be connecting to the sitting bone. So the sitting bone is deep down in between the buttocks. So if you bring your leg up, you can feel, can you see where my hands go? There's quite a bony part deep into the buttocks. That's the sitting bone. And then sort of, again, as I move, maybe feeling for connection from the front to the back. And if that's difficult for you, you can just move or have your hands on the hips. So there's different ways, but the invitation is to slow the movement down. It's like slow motion. And really notice, how does my body feel right now? How does my body want to move? It's forwards, back, there's sideways. There's figures of 8 you can do, circles you can do. And again, bring touch to the belly, also to the lower parts of the belly. You can bring touch to in your own space. Sometimes really nice to bring touch to your genitals as well. You think about the prostate area in the groin and in the insides of the groin. It's about welcoming. It's about normalization. is about finding ways to accept the change that's happening. And then maybe finishing off, we can come a little bit in the heart space also. So we've been down more in the pubic bone. But when we connect to the heart space, that's where the compassion lies. When the cancer diagnosis comes, it can be so difficult, so overwhelming. And particularly things connecting to the genital areas, there can be lots of shame, there can be lots of despair, overwhelm, self-hate maybe, not understanding. So something about bringing connection to the heart, bringing touch to the heart. And as Alex talked about the center we have in the belly. So if you bring touch to the belly, all over down, to the lower belly, to the pubic bone, to the genitals, but also to the heart. And maybe, again, just standing a moment. So letting your body be alive. There might be a little movement there. You can close your eyes. We can come into with the grounding meditation, grounding exercise. So in the standing, what might it be like to feel the earth under your feet? And if you're sitting, feeling the earth under your sitting bones. Feeling your heart, feeling your belly, feeling your genitals, feeling the earth. And then let's take that to a window. If you have in your room a window, just also connecting to nature around us, seeing the spaciousness to the sky, seeing the colors. I just see some geese flying around. I see the color of the hollyhocks. I see the movement of the birch leaves. Really taking in, I've seen the blossoms of the orchids in my room. So just coming back to your space, coming back to your room, to finishing off that exercise together. Find a little bit stretch in the body. I'm just going to time check a moment. It's gone 12:30. So in a minute we're coming to question and answers, and I'm give it back to David. But before we do that, let's just have another sitting down. Take a moment to integrate. If you chose to do along with me to explore, just notice what it feels like. For many of us, we're not used to that. We don't self-touch, we don't self-connect in that way. So just noticing, how am I feeling right now? How is my breath? How is my breath? Not trying to breathe in a certain way, just noticing, how is my breath? How is the tension in my body? How is my mind? This work with our senses, noticing, what do I notice about my room I'm in? What do I notice right now as I look around? Am I attracted to what is here? What is here? Great. So we're going into, Alex, if that's all right with you, going to some questions and answers with David. And I don't know if many come up, we answer them. If not, we can come back to maybe Alex got something else you want to say, but over to David for the moment.
Yeah, thank you both, Alex and Marcus, for that. I can't speak for everyone else, but I personally really enjoyed that, taking the time to focus on myself, and I think we often don't get the chance to do that, so I think that was really great. We have a few questions coming in. If you have questions, please just type them in the Q&A box, and I'll sort of ask them. So I've got one question coming from someone asking really around the struggles they have with erections, and also sort of not being able to produce any semen. Is there anything particularly in sort of your toolkits that you think would be helpful here?
Alex, do you know anything about points, or you have more the acupuncture knowledge than that? Anything?
Yeah, I mean, it's a big subject. I mean, I think it's kind of taking a bit of what I've been doing in terms of, nourishing the kidney energy. So it'd be like rubbing the lower back and also stimulating those points in the lower abdomen. I think it would be probably be really useful to go into an acupuncturist or a shiatsu practitioner, to get that support. There's also a point on the top of the head, and there's also a point in the ankle that raises the energy. So I mean, you can do this. It's like if you draw a line from the middle of your eyes over your head all the way down to the back, it's on that, and then if you get the apex of the ears and come up there, it's just posterior to the fontanelle where the hair naturally grows out. You can try and stimulate this with your fingers, with your thumb pad again, or your finger pad. But I think really, it's going to see an acupuncturist or a shiatsu practitioner that could do that for you and would know where the points are accurately. So it's I think it's a combination of maybe the potential of that some of the acupressure points will help, also to visualize. So Marcus did a little bit of imagery and visualization. You can just imagine that your energy is rising up. That you have it's an ascending energy. And in Chinese medicine, we have this loop that goes around the center body, so up the back and then down internally and then up the front, down. It's a bit like a figure of 8, and you can imagine. So we also think about this pelvic floor exercise where you're squeezing. It's almost like creating this pump in the pelvic floor, and imagine that the energy is rising up into the spine. But then you can read about that. It's we just don't have time to kind of go into that. But I definitely suggest it's like a bit of what I'm suggesting is doing some acupressure points on the practical level, maybe seeing an acupuncturist, but also what Marcus is saying as well. It's like really what he's doing is kind of I mean, I could let him speak, but it's what I was getting from that is like really connecting to the compassion in yourself, and the acceptance and the acknowledgement of what's happening and the emotion that comes with that initially, and connecting to that, really connecting to on a heart level, because obviously it's very challenging emotionally and very frustrating, and amongst other emotions. Do you want to add anything to Marcus?
Yeah, thanks, Alex. I think I can add to the latter half a bit, because I don't know about the ins and outs, in the medical, and I think sometimes maybe, around erectile dysfunction, and for some of you or for some men, that might be something that's actually there, for maybe there to stay or difficult to shift. But for me, it's more about, it's about befriending the body again, befriending that area. And I'm, maybe that bit that's still you, or that, that's still you, besides the difficulties, and finding a way. So if there's frustration and anger, to maybe something linking in with Alan talking about, to really be specific and to bring that into conversation, maybe even in a therapy session, and to have self-touch, kind of this kind and gentle self-touch, yeah, this is my body. So something about is maybe difficult to come out of the closet, who do I talk about that? But to make it more normalized, I have those difficulties, this is still me. And so maybe take the pressure off to have to achieve, and then it's more likely than the best. Once we're more relaxed, once I'm more relaxed, then it's more likely, and I welcome my body. Maybe then if there is a chance for things to come back, then it's more likely then for that to happen. Yeah.
Thank you both for that very much. Yeah, and I think that leads on nicely, although jumping ahead a few months, in December, we have some sessions on sort of sexual health and intimacy, and I know there's going to be a lot of talk, about all the different, ways that sort of, how we can sort of look to, even if we struggle with erectile function, still look to have intimacy and sexual health. So that, please definitely do tune in for that if that's up your street. We've got some more questions come in. I'm going to sort of fire off a couple at sort of the same time for you. So one, Alex, was really, how long should your exercises be done for? So sort of practical question. And then there were two sort of related. One was on Tai Chi, and then one was on Qigong. The Tai Chi one was, as a sufferer from prostate cancer, are there any particular moves and forms that would sort of really benefit me? And then on the Qigong, actually was a bit more, someone who's been attending Qigong sessions, which tend to have more female participants, is led by a lady, and he was wondering, should he be looking for one that's a bit more male oriented? Do you think that would help him?
Okay, thank you. I'll try and remember some of those questions. Well, I think the time, or how much you should practice. I think getting a regular practice is really important. So even if it's like 5 minutes a day or 10 minutes a day, 15 minutes a day, it's better than doing, kind of one session a week. And as you know, I've kind of been in and out of different kind of practices myself, where I've done, hours a day for many years, and then other times I do 1 hour a week. And I found that, it's much more effective to do a little bit every day, even if it's 5 minutes. So you get a regular practice and a regular, you can become more familiar with connecting to the exercises and what works for you. So regular practice, I'd say, is the best thing. You find the best day for you, or the best time of day for you. Some people find the mornings is good, sometimes the evenings. Sometimes it could be too stimulating in the evening, and you have the energy in the morning, and you just don't have the energy in the evening. So listen to your body, like Marcus is saying, really just listening to when it suits you best. I do run a course at Penny Bron. You're all very welcome to join. You just go to the Penny Bron website and you can book to join the class. I do that every Thursday morning at 10. There are many different styles. So Qigong, I mean, I didn't do any today actually. So I do apologize for those of you. We're looking forward to doing some. The time zoomed by. It's like a snippet of the Tai Chi form. So they're the same family. Someone called Mantak Chia, I mean, I don't know his stuff that well, but he's done a lot of work around what's called the microcosmic orbit. Sounds a bit out there, but it's really focusing on that energy, as I was saying, rising up through the spine, getting that circulation, raising energy. But all Qigong exercises, if they're taught well, will move the energy so your energy regulates. But you can think about, as I say, that ascending and rising energy up to the head. What were the other questions? So how long?
Tai Chi.
Yeah, what was the question again?
Any sort of particular moves and forms that were...
Yeah, it's just like I just said. Yeah, so it's a Mantak Chia. You can maybe have a look on YouTube, but all Tai Chi or Qigong exercises focus on regulating your energy. So I'd say all of it is good.
Brilliant. Thank you very much. There was another question. Would it be possible, and maybe this is something actually, for us for afterwards, to put together a list of the most important related acupuncture?
Yes, absolutely. Yeah.
Fantastic. Thank you. And there was another question, is there a list of sort of, prostate acupuncturists throughout the UK, or people sort of with that sort of specific experience with dealing with prostate cancer patients that you're aware of?
Well, I'm in Bristol, so anybody who's Bristol based, you can look me up, alexturneracupuncturist.co.uk. But the best governing body to go to is the British Acupuncture Council. So all acupuncturists who are a member of the acupuncture have been through a thorough training, usually a 4-year Bachelor of Science degree. So less so if you go and see a physio or an osteo that do maybe something called trigger points, which has its place, but it's almost more about releasing kind of tight muscles. Whereas if you go to traditional acupuncturists, they can focus more on the root causes that will help with prostate cancer. So the British Acupuncture Council is the main governing body. You can put your postcode in there, and then you'll come up with acupuncturists near you, and you can just have a look at their website. And I'm sure hopefully they'll be up for talking to you.
Brilliant, thank you. And then we have another question. I'll just sort of give a quick summary of it. Was a gentleman's been suffering from chronic fatigue for many years and has a number of problems since having his prostate removed. Still has incontinence and erection problems, and was recently diagnosed with autoimmune disorder, lupus, and possible osteoarthritis. Basically, what he's getting at was he wants to know if you thought acupuncture would be helpful for him or possibly not advisable due to his lupus.
No, absolutely fine. Yeah, I mean, just if you go and see an acupuncturist or a shiatsu practitioner, you'll have an in-depth consultation, so you can present all that information, and they'll discuss with you the appropriateness of the treatment that you'll receive. But yes, acupuncture was fine. And shiatsu, and also just to say that acupuncture, the needles are not for everybody. Something that Marcus was bringing is that kind of touch. Even as an acupuncturist, I know how effective it is, but I do prefer to go and have a shiatsu because it just feels so good, and it's really embodying, and it comes back to the body, and it has the same effect, moving energy around the body and rebalancing the body. So also really encouraging you to, think about what Marcus was saying, is this having this, this body work, this touch, and I think that's fundamental also to some of the issues that Mark was saying about shame and intimacy and difficulty connecting when that's going on for a man. Just to have that professional touch to really help you relax into that space. Did you want to add anything to that, Marcus?
Yes, and like this particular example is when many health conditions come together, and low energy, and to, again, something about self-touch, and particularly working with the bones, connecting to the bones in the body. If I'm very tired, that can help self-energizing. So if I do very gentle touch to my bones, so feeling into the bones, and there can be different places as well, anywhere the bones, touching and working with the bones, that can help with tiredness. Yeah.
Brilliant. Well, thank you both very much. It's actually just taken us exactly to time, and we've got through all the questions as well. We will, as ever, be sending a recording of this out to everyone who was in attendance and also those who were unable to attend. And we're also going to include a few top tips from both Alex and Marcus to help, hopefully ensure that you can, take some of these practical approaches and embed them in your daily lives and your routines. So we hope that will help you. Thank you everyone for attending, and a big thank you to Alex and Marcus for today's session. And just a reminder for everyone, Penny Braun UK's website really is a fantastic resource, and as mentioned, there are tons of different things that you can sign up for there. And it's one of the reasons why we wanted to do this, the first month with them, because they've got some really fabulous resources for people with cancer, and obviously for people with prostate cancer as well. So do really recommend you check those out. Thank you all very much again, and I look forward to hopefully seeing some of you in our next month on nutrition.